welcome everyone. I'm going to go ahead and get started. We might have some people joining us in the next couple of minutes still, but welcome to Superior Health's Fundamentals for a Culture of Continuous Improvement Teleecho. So this is our very first session. My name is Elena Smith, and I'm a Quality Improvement Advisor for Superior Health Quality Alliance. Typically, I'll kind of get started with some announcements at the beginning of each week. Today, since this is our first week, we really don't have much, but I do just want to remind everyone that we will be utilizing case presentations throughout each of these echo sessions. And for today's case presentation, since it's our first one, we just kind of created one, but we'd love to hear from all of you. So if you have something that you wanted to present to the group, please feel free to shoot me an email at esmith@mpro.org. And I can kind of walk you through the process, and we'll make sure to send out the case presentations template to all of you after today's session, so you have access to that as well. So today's agenda will include an introduction to the ECHO process, very brief. I know probably several of you sat in on our introduction to the structured collaborative and ECHO framework last week. And if you didn't, you can definitely check out that YouTube link. I can put it into the chat in a little bit and watch that if you want to get to know ECHO a little bit more and kind of what we'll be doing with these structured collaboratives. After that introduction, we will do some participant introductions. So one of our goals here is to kind of create this networking experience, so you'll get to know who else is on the call. Then we will have a didactic presentation on leadership by Barb Link. And finally, we'll close it out with that case presentation I mentioned and a discussion by me. So as I mentioned, each session will include a short didactic presentation to provide some information that we hope will be helpful. And Project ECHO is a case-based learning program. So the majority of our time will be spent discussing actual cases that you have sent in to us. Today, it's going to be a little top heavy because we are kind of getting into it. This is our first session. So those introductions might take us a couple minutes, but for the most part, it is that case-based learning. So we want to hear from you. As I mentioned, we have that standardized case presentation form, which you'll get to see a little later today. If you do fill that out, please remember to not include any personal health information. If you ever have any questions or want to submit a case presentation, as I mentioned, please email it to me at esmith@mpro.org. The goals for our ECHO sessions are to create a community of learners who engage in an interdisciplinary conversation that supports organizational staff, providers, and patients. For a couple of housekeeping reminders, all sessions will be recorded. We would like to see you. So if you have access to a camera, I know a lot of computers within several organizations don't have a webcam attached to them, but if you do, we'd love to see you. So please turn on your camera. We ask that everyone makes a practice of entering your name and your organization in the chat box when you join the session so we can record our attendance. So if you want to go ahead and do that right now, again, that'll be your name and your organization in the chat box. If you do have anyone else in the room with you, please feel free to let us know who's there so we can take that attendance. It is helpful to us if you revise how you're identified. So if you're noticing that your name that's showing up in your box is not correct, you can hover over your thumbnail and click those three dots, and then there will be an option to rename. You can click that and enter the correct name. So just as a quick tip on that, if you do get an invitation for one of our Superior Health events forwarded to you from someone who registered, it will always show up as that person who registered name. That's totally fine, but then just when you enter, so we don't call you by the wrong name, feel free to rename yourself. And if you aren't getting any of our Superior Health emails, let us know and we can make sure that we're adding you to the communications list. We do want to remind you to mute yourself when you are not speaking, and remember to unmute yourself and state your name when participating. There is a raise hand feature in the participants section of the menu. So if someone else is speaking and you would like to hop in and speak after them, you can raise your hand using that function and we will make sure to call on you next. Just as another reminder, do not disclose any personal health information during our discussions. If you are having any trouble with Zoom, you can message me, Elena Smith, using the chat box. Within that chat box, you can select the two. It's either to everyone or you can search for a specific person. If you have any other questions or comments, you can message Barb Link, who will be monitoring our chat right now. And when Barb's speaking, I'll kind of be playing that role as well. If you have questions or comments that you'd like to make to the whole group or that might be beneficial for the whole group to know, feel free to just chat that to everyone. Please help us foster a positive learning environment when asking questions and making comments. Remember that we're all here to learn from each other. So with that, like I mentioned, we will take some time to get to know who's participating in our community today. I'll start by calling out your name, and I'll ask that you please unmute yourself and tell us your name, your position, your organization, and your location. I know also some people don't always have access to a microphone on your computer. If that's the case, we will make sure to provide you with the phone call in line. That's going to be really important. Like I said, this is a great opportunity to network and talk with each other. And that's how these echoes are super successful, is when we have that opportunity to have those conversations. So if your computer does not have a microphone, next week you may want to focus on trying to call into the line that's located in the calendar invitation. So with that, I will kind of begin. As I mentioned, my name is Elena Smith. I'm a quality improvement advisor with Superior Health, and I am located in Michigan. So I'm just going to go through this list. I know we have several people joining us today. It looks like 26. So I'm going to go through the list, and I'm going to call on Kit next. Kit, would you like to unmute yourself and tell us those things?
Yeah, I'm Kit Roosh. I'm a quality manager with the Aging and Disability Resource Center of Central Wisconsin. I'm in Central Wisconsin. Yeah, and here just we work a lot with transitions of people from nursing facilities to the community. Great.
Welcome, Kit. Glad to have you here. Next up on my list is Kimberly Gamaro. I might have said that incorrectly.
You did pretty good. Hi, Kim Jamaro. I'm in the Metro Detroit area with Beaumont Health Senior Services. We operate 2 skilled nursing centers and 2 assisted livings on 2 retirement campuses.
Great, welcome, Kim.
Improvement specialist.
Welcome. Next on my list, I have Aria Wanmacher.
Hi, this is Era. You did a good job with the name. I'm in the Minneapolis area, and I work for Care Choice as the education director, and we work with skilled nursing facilities on quality improvement projects.
Great, welcome, Era. I won't forget that next time. Next, we have Alyssa Elliott.
Hi, my name is Alisa Elliott. I'm a clinical effectiveness specialist at Maple Grove Hospital, and I'm located in Maple Grove, Minnesota.
Great, welcome. I'm going to make sure I'm using my quality improvement strategies to get your names right for next time, but there are a lot of you, so I apologize if I say them wrong again in the future. So next, and I think we'll need to rename. Barb, could you assist with that? But I'll get to Claudia next.
Hello, my name is Claudia Chavez Rhodes from Upper Peninsula Healthcare Solutions located in Upper Peninsula of Michigan.
Great, welcome, Claudia. Anna.
Hi there, sorry I just got on late. I'm Anna Pollack from Ascension. I am the Director of Transition Care for Michigan Market.
Great, welcome, Anna.
Thank you.
Next we have Emily. Emily Narrator. You might not be able to unmute yourself. Maybe you don't have a microphone, and if that's the case, that's okay. Next time we can make sure we send out that. Oh, you might have unmuted yourself now.
Hi This is Emily Narrator. I'm from Henry Ford Health System in Detroit, Michigan, was where our headquarters is.
Welcome, Emily. Next, we have Janelle Shearer.
Hi, everybody. I'm Janelle Shearer. I am a quality improvement advisor and a part of the Superior Health Quality Alliance, and I'm based in Minnesota.
Thanks, Janelle. Next, we have Jennifer Friday.
Hi, I'm Jenny Friday, and I'm a nurse care coordinator and population health nurse at Wellia Health, which is in Mora, Minnesota.
Welcome.
Thank
Next,
you.
we have Jennifer Jurdy.
Hello, I'm Jennifer Jurdy. I'm from Ridgeview Clinics. I'm the lead RN navigator for our primary care clinics, and I'm located, we're kind of southwest city, so I'm physically in Delano.
Great, welcome. Jennifer Capon.
Capon. Thanks. Hi, everybody. Jenny Capon. I work and live in the Minneapolis area in Minnesota, and I'm a performance improvement specialist at North Memorial Health.
Welcome. Lots of Jennies here, so we'll have to make sure we get your last names correct for them, for all of those. Next, we have Lauren Martin.
Hi, I'm Lauren Martin, Manager of Clinical Effectiveness of Maple Grove Hospital, which is part of North Memorial Health, and that's in Maple Grove.
Welcome. Next is Linda.
This is Linda Hespy, Essentia Health Home Care Director, and we are located in the northwest corner of Minnesota, so we have 5 agencies in that area.
Great, welcome. Margaret Leitner.
Good morning. I am with Beaumont Health in southeastern Michigan.
Welcome. Megan Melberg.
Good morning. My name is Megan, and I'm with Woodside Senior Communities. I'm the administrator here in Green Bay, Wisconsin.
Welcome. Michael Ferris.
Hi, this is Mike Ferris. I'm the Executive Director of Gloucester Hills Care Center, a 143-bed skilled nursing facility. We're located in Southfield, Michigan.
Welcome. Michelle Pieper.
Hello, my name is Michelle Pieper. I'm the Executive Director at Rivergate Healthcare Center, which is located in Riverview, Michigan.
Great, welcome, Michelle. Nicole.
I'm Nicole Meyer. I'm the clinical manager and QAPI suit coordinator for Good Samaritan Home Care St. Peter.
There we go.
Which is in
a little bit. What state are you from, Nicole?
Minnesota.
Minnesota. Welcome, Nicole. Up next is Steph Davis.
Good morning. I'm the System Director of Quality at North Memorial Health, so I oversee both North Hospital and Maple Grove Hospital in the metro area here in Minnesota.
Great, welcome. Terry Shelton.
I'm Terry Shelton, and I am the Director of Quality Improvement and Population Health for Integrity Health Network. We're an independent technical association made up of primary and specialty practices in Minnesota and northern Wisconsin.
Okay, it was a little tough to hear you, but I heard Minnesota, but we can kind of work with you on getting your sound quality a little bit better. You know, it's always difficult when we're moving to this virtual world, but I heard Minnesota, so welcome. Todd Langton.
Hi, this is Todd Langton. I'm an order set specialist for North Memorial Health in Minnesota.
Welcome, Todd. Susan Nilsson. Oh, I don't see. Oh, do you have, is that your phone number? Are you called in by phone?
No, this is Lauren Martin. So Susie is with North Memorial Health. I don't think that she has a microphone. So she is a quality improvement specialist at North Memorial Health in Minnesota.
Great. Thank you, Lauren. And welcome, Susie. I do see that there is a phone line. If that's you, you can press *6 to unmute yourself if you're joined by phone. you want to introduce yourself.
Hi, this is Susie Nielsen, and thank you, Lauren, for introducing me.
Great. Thanks so much for joining us, Susie. And then we have Darlene.
Hi, I'm Darlene Nadine, and I work in Michigan, mid-Michigan with the nursing home waiver and nursing home and hospital transition programs.
Great, welcome. So I have one final introduction, but I'm just going to mention, you can see that we have a pretty diverse group of people here today across all three of our regions, or all three of our states within our region. So we're so happy to have you all here. Kind of some of the benefits of an ECHO is if you are able to join each and every week, you can all get to know each other really well. If this is some group that you'd really like to continue, maybe there are some other topics that we can focus on for some future ECHOs and continue to work together. So with that, I do want to introduce or have Barb introduce herself, and then we will move on into our didactic presentation for today.
Thank you. And I apologize. I think I missed probably about 4 people on the attendance list. Sorry, Elena, but hopefully we'll nab those people before we're done. I'm Barb Link, and I'm a quality advisor with Superior Health Quality Alliance as well. And I'm here in Michigan with MPRO, which is the quality improvement organization here in Michigan through Superior Health. And today I'm going to be talking about quality fundamentals for a continuous improvement culture focused on leadership. And so I'll be talking, we do have a diverse group of people here. It's wonderful. You're from a variety of settings. I'm taking this sort of from a healthcare perspective, but I think many of you could transfer much of the information I'm providing today to the setting that you're working in as well, if you're working in a community-based organization or some other sort of setting. Also, it is very introductory information that we'll be providing throughout this particular ECHO. So if you're a well-established quality improvement person, this might sound pretty basic to you, but I'm hoping there might be one nugget of information that you received today that you find beneficial as well. So with that, I will get my presentation up here.
While Barb's doing that, I do want to apologize if I missed anyone. I might have, because I see that we have we have 27 participants today. So I apologize for that. We'll make sure we don't miss anyone next week. Thanks, everybody.
All right, is everyone seeing my first slide now? Okay, great. So the high-level objectives for today are to learn what makes a good leader for healthcare quality improvement, understand the impact of self-awareness and emotional intelligence as a leader, how to integrate vision and goals into staff's daily work, and understand the 9 factors that impact success as a leader for quality improvement efforts. So I'll be going into Dr. Crane's thoughts on what makes a good leader in a healthcare setting, but his main idea, I really like this quote, though it might not be the best grammar in the world. He says, you have to be a really good leader, and not the kind of leader that tells everyone what to do, but the leader that listens. And I'll be circling back to that a little bit later in this presentation as well. So from the perspective of having essential skills for leadership in healthcare quality improvement, I really liked the thoughts that Julie Klieger had on this. And so all of these resources that I'm talking about today, I have a slide at the end of this presentation with links. So if you want to find out more and more specific information in this high-level presentation, those will be available for you as well. So to start out with a very high-level thought on what leadership is really thinking about your organization and its vision, mission, and goals. Now, I know many of people have gone away to retreats or had to Google what is a mission and just sort of gotten that down on paper and really not integrated that into the daily work of everyone at your organization. Or maybe the frontline workers really don't feel that the vision, mission, and goals speak to them. So as a leader at a high level, one of the most important things to do is really to understand your own vision, mission, and goals for your particular organization and see that those are carried out on a daily basis at all levels. So people are really unified around those when you're needing to introduce a change, or that they know what you're really trying to achieve, especially for patient care or for the consumers that you're providing care for. Some of those ways that you can really integrate that into the daily work is, how do you communicate that vision? How do you keep it forefront? And this takes a lot of work, and given our current environment that we're dealing with, this might not be top priority, but it does help when you are in a crisis or you're really needing all hands on deck, that everybody has a unified vision as what they should be doing to provide care. So when you are having time to be able to do these sort of things, having group meetings, schedule individual meetings, all of these things to really talk to people about what the vision of the organization is and how do they see it, and get that feedback from them, and also help them understand from your perspective what it means on a daily basis and on a larger scale for your organization. And one of the main points I thought it was really important to think about when you're trying to integrate that philosophy into your organization is engaging the critic. Everybody always sees that person at the meeting who's checking their watch or huffing and puffing, rolling their eyes. Oh, they have to get on to their next appointment or whatever it may be. And they're not really listening to the content of the meeting. They're not really integrating what the vision and mission is of the organization. Pull that person aside, ask them why. Those physical characteristics that they're exhibiting during the meeting probably are being exhibited outside the meeting when you're not around. And those kind of characteristics can be toxic for an organization. But then on the other hand, the critic could have some insight as to how these might not really feel relevant to them, and maybe even not relevant to other staff, but they don't feel that the culture is such that they can talk about it. So I think engaging the critic, somebody who you feel might not really be on board, can be very instrumental in integrating that vision, mission, and goals into your organization. These two concepts, I think, as a leader are very important to get buy-in from all levels of staff that you're working with. Thinking of creating a culture of constructive accountability and constructive conflict. Constructive accountability is that shared aim with diverse populations and uniting them under a common goal. And so you may have different departments that never even talk to each other. Say you have a case management department that has to do discharge planning for people, and then you have a surgery unit. Maybe they never even really interact very much, but one of them is having a difficult time. If you can bring in some way, shape, or form, there might be something within these two very separate groups that they can share and work together. And if they're feeling like, as a whole organization, they're accountable for the good work over there across the hall, it can just mean that much more for the whole organization. So really seeing how all the parts fit in to make the whole. Constructive conflict is a little bit more challenging. We don't really live in a culture, well, in this day and age, sometimes conflict seems part of our everyday world, but sometimes really trying to process it and work through it in a positive way is very challenging for people. So constructive conflict is a process in which two or more people or groups discuss their needs and differences of opinion and eventually develop a solution to that. So really having people hear each other and be able to be that leader who can convene those people together and get that dialogue going, have it be constructive, have them talk about their opposing opinions, and get it to have a final outcome and a solution are qualities of a very good leader. Other components are removing those barriers to success. Very simple example. You have a hand washing intervention showing people exactly how you need to wash your hands and keep proper hygiene, but you don't provide the proper supplies for them to actually carry it out. You need to remove any type of barrier for success. And if people are seeing it, if it's real or imagined, how do you talk that through with them to remove that barrier and help them be the most successful person for your organization? Think about coaching versus telling. When you are engaging someone and helping them understand what their best abilities are, to inspire and empower them and really engage that person, that is very productive as a leader versus just having that top-down approach and telling them what to do. Of course, we always know that there are certain times where you might just have to tell somebody what to do. But if you have been a person who's been engaging them in the process all the way along, when there's an emergency and something has to be told and just implemented, much better engagement when you've been a person who's been cultivating that relationship and seeing that they have the power to be independent workers and are very creative. But in those emergency times, they will also come and do what you need to have them do as well, because they know that you're someone who's been supportive of their work in the past. Then also celebrating success and failures, and not just the successes, but looking at the failures. Sometimes being honest that this didn't work. That's an integral part of the example of the Plan, Do, Study, Act as well. We'll be talking about that in the future, but when you're constantly evaluating and assessing a situation, trying to improve on it, there will be failures. It's integral of that process. And when you can celebrate it, then it limits it in the future. When an organization feels comfortable actually writing down what a failure was, then people can go back to that and see what that was in the future and not repeat it. So seeing that failures can be celebrated as well as your successes. Of course, earning trust of your employees at all levels is very integral in leadership. People who are concerned and don't feel comfortable asking questions or engaging with leadership, those are the ones who make mistakes and bigger problems come of it. So all along the way, dialogue must be kept and people need to feel trust that's established. And then creativity comes from it. When people feel comfortable talking about things, sharing ideas, asking questions, only that much more of a richer organization will come of it. I think this is a very important concept for a leader to think about. Of course, technical intelligence is an integral part of everything that you do. You need to know exactly how, having skill base, knowing how to implement things, but also as time has evolved, emotional intelligence has also become a very important part of being a solid leader. And that's somebody who's always thinking about how they are conveying things to others, being reflective on their tone and their manner, and just having a self-awareness of how they're being and having emotional empathy for people. I have some resources that can dive deeper into what emotional intelligence is and how it engages patients and coworkers, as well as people that you're managing. It's very powerful. And so you need to have technical intelligence as well as emotional intelligence to be a true leader. And working with and through others. So successful quality improvement requires routine collaboration among leaders and frontline leaders, and really taking that team approach to bring improvement and have multiple perspectives that can really help to spark those creative solutions and really develop an environment of trust and true collaboration among everybody throughout your organization. So now I'm going to go back again to reiterate about how being a really good leader incorporates listening. So through Dr. Crane talked about specifically in a clinic setting, some of the ways that he's introduced quality improvement and the things that he's honestly learned along the line. And some of these things are in those 9 principles as well. But I really liked his main 4 bullets, just really the thought process of you need to be patient. You need to think about being process oriented, and that can take time. And it can take time for people feeling truly comfortable about telling you this really isn't working. And when you're a good leader and someone steps up and says, you know what, the program you implemented and thought was so great, it's just really not working on the front lines here. That means you're actually a great leader. Somebody felt comfortable enough to talk to you about that. Being mathematically and data inclined, of course, we all know that data can really drive quality improvement, but using it so people can understand it, see that it's productive, see its outcomes, see that really when they took the time to use some of the tools that you're talking about, that they really did see, on those certain days, we really aren't getting patients back as quickly as we should into the exam room. And I didn't really see that before. And on other days, what is that process that's working so quickly that you can really talk it through with them, not make it mystical, keep it easy, but it can be very helpful. And through some of our other training sessions, Elena will be talking about that as well and showing some really great ways that you can integrate that for your different settings. You have to be compulsive and not give up. Lots of times people do one PDSA and they get to the plan due and they didn't study or act, or they just got too distracted and it was just too difficult. But sometimes when you constantly get that culture ingrained and don't give up, it can be really productive in the end. And then really, to be a good leader, you have to listen. You have to gain consensus of your staff. And you have to realize the change can be gradual, and you have to get buy-in, and it's not a top-down thing. So I thought I would just take a minute and see if people had some thoughts on the two different statements that I've put up here. And one of them is, Dr. Crane has a plan. Here it is. Let's do it. And the second statement is, okay, here are the two problems we're going to solve, and you guys find out how to solve them. Anybody have any thoughts about how people at your place of work might respond to the two different statements? Some people chatting in.
I'm seeing a question in the chat. So if you do want to raise your hand, it should be in that participants window down at the lower left-hand corner. So if you click the participants button, but if no one else is talking, feel free to just unmute yourself and speak up.
Hi, this is Kim Jamaro. I don't see that button, but I think between the two statements, the first one doesn't consider any frontline view of the problem that's trying to be solved, potentially, or perhaps it happened before the plan was developed. But statement 2 is at the far other extreme. So it also kind of says, I recognize that we have a couple of problems we're going to solve, and then it sounds like we're just walking away and waiting for staff, to pick up that cue and run with it. And I think what they might prefer in a team approach is something in between and a coach alongside them.
That's great, Kim. It's true, that last sentence, even though I think in this article, he thought it was very supportive compared to what he was used to doing. It really is almost saying, just go ahead and do it. I'm going out to lunch. So I agree. He did find that, that top-down approach really did not work, that people really had a hard time integrating anything he ever just told them to do. But when he did find the right words and to talk about how can we work through this together, he found that people really integrated more, had great ideas. It was more of a collaborative approach, and everybody bought into it much better. So I really like the way you said it, Kim, that it's really more about trying to figure a middle ground and saying, we're in this together. How can we work through this together as your leader, I can provide assistance, tools, guidance, my knowledge of quality improvement, but I know you're there on the front lines and know many of these processes. How can we sort of talk this through a little bit? It also helps people feel more independent and feel that, you know, on a daily basis, if they're on the right track, that they can keep doing these things and don't have to ask for affirmation all the time. And so, again, it's that they constantly are thinking of some of these concepts like plan, do, study, act, or figuring out what the root cause is, integrating some measurements and that sort of thing into figuring out where the real problem is within a whole process. And so it gets into sort of almost like an autopilot when they're doing continuous improvement constantly and seeing how in this area, oh, it worked this way. Maybe when I do this process, I can do some of the same concepts and improve this process over here in this way. I did want to just touch a little bit on thinking about leadership in a COVID environment. And this also is from a particular article that I highlighted at the end in my resource list as well. I really liked some of the high level thought processes that came from this. And so when you're thinking about it's like crisis intervention, but when you're thinking about this, who are the correct leaders that are going to be really team players at a time like this? Who are going to bring people together? Who are going to be able to think on their feet and help other people continue to do the best job that they possibly can? You really need to think about when you're convening a team and trying to get the leaders together to implement a process. Who are those people that are going to be able to, in quick order, communicate that to everybody and get buy-in? You need to think, of course, about your staff and their own health and morale, because if they're not taking care of themselves, they can't take care of others. It's a real challenge when you're short-staffed. It's a very big challenge when, you know, people have to quarantine and you're trying to find somebody to fill in. But if you can, it's really important not to forget about that the staff need to take care of themselves as well, be it with your employee assistance program, mental health services, thinking creatively, what is supportive to them? Do you need an on-site daycare all of a sudden that wasn't there before? How can you do that for them? Listening to what they need so they can provide care and be supportive to the patients that you're trying to provide care and support to. You really realize at times like these that creating a culture of preparedness is very important. Everybody needs to have an emergency preparedness plan. Does everybody know how it works? Does everybody at your organization know what their role is in that emergency preparedness plan? When there isn't a crisis, make sure that that's always integrated so people can know when there is a crisis, what is their role? What do they need to be doing? Just have that culture of preparedness at all times integrated in what you're doing. And of course, communicate. You know, and if it needs to be daily touch bases and convening that group of high leadership so they can even for 15 minutes to know what are the best practices, what changed today, what's the CDC saying, get that together and get it out there for people. What's the best way to get it out there for people? Is it through your website? Do you have some communication? I know a lot of people in home care have apps now that really can instantaneously communicate to people out into the field about what's going on. All of these things need to be constantly thought of and be creative about them. Set up a robust clinical decision-making process. And some of those things are always know to bring your best clinical minds together and provide the best advice in any kind of crisis. And that can be on a day-to-day basis, it can be on a weekly basis, but constantly think of who are those people who are really able to think on their feet and make those quick decisions that you need to, and can really redo things and processes that need to be redone, maybe even on a daily basis. And I think this is important to remember to cultivate those relationships with your external partners because you're going to need them in a crisis. I think everybody's sort of seen that now. But if you're healthcare organization and you're making community referrals, do you know those community referrals? Do you know point people at all those places that you can quickly make referrals to when you need to discharge someone back to the community? How do you know, who are your suppliers that you need to know of? Do you have a good relationship with them? How do you talk to them on a daily basis that when you're in a crisis, you really know everybody and can get them on board and really reach out to them when you're needing a special favor? I think that's really important to think of when you're talking about a crisis environment that we're dealing with. So those are just a few things about thinking about leadership in regards to quality improvement. The next session, we'll talk about this later too. We'll talk about building your team and for quality improvement. But here are references today regarding some of the specific things that I talked about, as well as some general websites that I always find helpful when we're talking about quality improvement, like the Institute of Healthcare Improvement and the National Association of Healthcare Quality. So those are just some of the references. And I think, if you want to find out more, many of those have detailed links in them too to provide more information about leadership in a quality improvement environment. Anybody have any questions? And I do apologize for my raspy voice. All of a sudden the weather changed and I started to get those lovely winter allergies. So I apologize for that. Well, if you think of questions along the way, we can always circle back. I think we'll move on to the case presentation here, and I will stop sharing.
Thanks, Barb. Okay. I am going to share the case presentation. As I mentioned, because this is our first session, this case presentation we developed it within Superior Health. So it's pretty general and broad. It probably can kind of relate to many of you and what you're going through right now, or maybe what you went through if you are more advanced in quality improvement, what you went through when you got started. So I want you to look at this when you hear kind of more about it and start thinking of maybe some case presentation that you could present in the future. It doesn't have to be a specific case. It can be a process, maybe something that you want to do to get feedback from others, or something that you're doing right now. You still want that feedback or recommendation. So keep that in mind as we go through this case presentation. So my name is Elena Smith and I am presenting from Sunnyside Clinic. So my plan is to advocate for the importance of a designated quality improvement team within Sunnyside Clinic. So I am going to analyze our quality measures and compare them to the benchmarks. I will pull those that are deficient and create a report showing how deficient we are and ideas for how we can improve the deficiencies. During an all-staff meeting, I will present this information to my leader and explain how a designated team can work together to improve our quality, which will lead to better patient care and more reimbursement. I will also advocate that this team should also be in charge of our current COVID processes and research how we can be more quality driven with that as well. So who's involved with the implementation of this? Myself, Elena Smith, the clinic manager, and Marcia Brady, she's an RN. So how will I monitor implementation? We already are monitoring our quality measures, but we don't use them to drive change right now. We have an unused whiteboard in our lunchroom that we could use to track our quality metrics monthly compared to the benchmarks. So since I haven't done this yet, there are some sections that I didn't fill out. When you're looking at this, you can do the same. So did I face any challenges? So in anticipation of some challenges, I'm anticipating getting some pushback from leadership because the person who held my position before me tried to do something similar. I think focusing on benchmarks to show where we can improve will be beneficial. So what am I going to do now? If approved, Marcia and I will invite a diverse group of staff members, likely a representative from each position, to join the QI team. The team will develop a 6-month plan to determine what projects we can take on right now and what projects would make providing care more efficient during COVID. So time could be a big issue with that. We are pretty strapped for time right now because of COVID. I am hopeful that this team could identify areas to make our processes more efficient so that we have more time to focus on other quality metrics while also making COVID processes run smoothly for staff members right now. I'm also concerned that we might get pushback from staff once we introduce new quality initiatives. So we'll need to identify team members that can inspire and encourage others to join our QI team, and we'll call those people our champions. So the specific help that I'm seeking from the group today are some strategies to improve my pitch to my leadership team, some good places to start my quality improvement work, and then some types of quality improvement projects that you've done to improve efficiency of care or care in general during COVID-19.
So I would just like to summarize what Elena talked about, and then we'll open it up to the group for clarifying questions and recommendations, and I'll sort of put definitions around that as well. So Elena would like to introduce a process to track quality measures and compare them to her clinic benchmarks. She wants to present this to staff and convene a quality improvement team within the next 6 months. She wants to get buy-in from leadership, and she does know that something along these lines has been introduced in the past without much success. She wants to move this to the next level and not just track the measures, but she wants to use it for the next step of quality improvement and institute some areas of improvement into the clinic from tracking those measures. She does have some other concerns about trying to get buy-in. She's concerned that during COVID that there might be some challenges to try and implement a quality improvement initiative. And she wants some assistance to see if other people have done some of the similar things in their organization and how they've been successful with that. Elena, is that sort of catching in general your?
Yeah, definitely.
Okay. So with that, we'd like to open it up for like clarifying questions. Does anybody have anything that they were wondering a little bit more about, or something that might be helpful to help with the answer that you might provide afterwards? So right now we're just asking clarifying questions, and then we'll get into the recommendations in a little bit. Anybody have any questions about her situation?
This is Jenny Capon. For the change management, do you in previous projects use any kind of change management techniques that are out there, like 4Ps or ADKAR?
I'm actually not familiar with those yet, so I would love for you to learn more about those. If you want to maybe send some links in the chat or anything like that, I'd like to learn more about that to maybe utilize some of those.
Will do.
Thanks, Jenny.
This is Darlene Nadine from the A&D Waiver and Transition Program. I am wondering, you've mentioned the Plan, Do, Study, Act a couple of times, and it might not be relevant right at this moment, but it would be something that maybe we could talk about more in the future, because I don't know if everybody's familiar with those and how valuable they can be.
Yeah, that will be great. I think especially for this type of project, doing a PDSA will be beneficial to what we're working on.
And I think that would be something when you're doing the presentation, for this case, well, for any case, it would be something that would be valuable to put in your presentation to get the buy-in of, those that need to, because they would, I think that it would help them see how we would come to some conclusions.
Yeah, that's great. I'll definitely include that. And I know Barb had a link to PDSA in her presentation today.
Yeah, and wanted to get into that a little bit more in the future. So yes, thank you, Darlene. I appreciate that. Yep. Well, and I was just curious too, Elena, if you had any insight into, you said that someone in your previous position in this example had not had success with trying to implement something like this with leadership. Did you know what had happened with that, or any issues that the leadership had with the way it was implemented before?
You know, I'm not super familiar. I think that person had just started out as well, and they didn't have enough of a plan and their staff buy-in at that point in time. They were just going in on their own. They didn't have a secondary staff member to support them, and they hadn't identified those champions like we mentioned, what our plan is. So I think that was probably one of the issues with what they were trying to present.
Does anyone else at this time have any other questions before we start getting into recommendations or thoughts on recommendations? Let's see. And the 4 Ps are been put in there. Thank you very much. And
yeah, that's going to be really helpful.
Okay. So the next component of the case presentation is talking about moving into recommendations. So if people had any questions or were wondering about specifics about the case, that was the first section. Now we're going to be talking about recommendations. So this is where you would, for example, provide the information. I think that's a perfect example about the 4 Ps, which were put over here, and maybe even specifically taking that and saying, how would you introduce that into the clinic where the leadership is pretty tentative, feels like someone else tried to do some quality improvement but didn't see a lot of success in it, thinks they're too busy for this sort of thing and people just need to do their jobs. So how would you sort of help support Elena in thinking about talking to leadership about this and getting this initiative moving forward in her clinic?
Since I added the 4 Ps, I'll just speak to, how I might use that, not knowing the people. But I think one thing that this speaks to, and it's not necessarily like a step-by-step do all these things, is that each leader is going to respond to different things. Like some leaders are data leaders. They want to hear the data and the metrics. Some leaders are tell me a story and get me excited. So I think part of it before looking at the different pieces of it is to figure out what kind of leader you're working with and then kind of match it up to your strategy for impacting them.
Yeah, that sounds like a great plan and something I'm going to focus on over the next couple of weeks before that next all staff meeting.
Yes, it's very true. You don't always have a leader like I tried to frame out. So sometimes you have to figure out what sort of leader do you have and how to talk to that leader. So that's a really great point. Okay. Anybody else have any thoughts? So the person that you're thinking of working with, Marsha Brady, Marsha, is she someone that the leader listens to? Is it someone that the particular leader has somewhat respect for? Maybe Is that something that could work well to your advantage? Or how did you decide to have Marcia be your partner in this?
Yeah, so Marcia has been with our clinic for many years and has worked with my leader for many years as well. And since I'm new to my role, I thought that working with Marcia would be a smart strategy. She has the respect of our leadership and the other staff members. So our MAs, our front desk staff, she's well respected by all of them. So getting her buy-in was something important to me. And then hopefully her showing the importance to what it can do for our clinic will help kind of spread that importance to the other employees as well.
I certainly think that's a very good start, and it doesn't sound like the intervention doesn't sound too costly. You have the equipment there already. There's nothing that's being added. Okay. And again, thinking of some of those things like cost benefit to the organization, getting those things ready beforehand, having as much information. See, it says Natalie saying, unless I missed it, it would be helpful for participants to have a copy of the case study for reference and discussion.
Yeah, thanks for that recommendation. We can start making sure we send that out to everyone for our next call. Kind of speaking of that, like we mentioned, I know we only have a couple minutes left. This was kind of our take on the first case presentation. So thank you for providing such great information already. So we're excited to see what you guys can come up with in the future. So again, I'm going to share the case presentation one more time just to show you what that template looks like. Should be up on my screen now. It's pretty simple. It has some prompting questions. If the questions don't fit with what you're trying to describe, you can either skip that and add more somewhere else that it does fit better. But we do want to hear from you. If there are some things, like I've kind of tried to give some ideas down in here, maybe some QI projects you're doing right now during COVID-19 that you want to share with other people and maybe get some recommendations or ask for help with some barriers or anything like that, or just spread the word on something that's working really, really well for you and how you did it. I think that's going to be really beneficial to spread that knowledge to other people because we're all just working really hard to kind of get through this time period. Maybe some other ideas. We do have a wide range of people's where they're at with QI work. So if you've done some really cool QI projects in the past that you'd like to share with people, or if you're thinking about things that you could do within your organization that maybe some other people have already done on this call, you can kind of present that here and hear from others. So we definitely want to hear from you. If you do have a case presentation or a thought in your mind about something you would be willing to present for next week or one of the other next 5 weeks, feel free to let me know. My email address is esmith@mpro.org. I'm going to be sending this case presentation template out to all of you at the end of this meeting, or if you want to do it really badly, you can let me know right now and I'll make sure you get it right away. And I see Kim says how collaborative members approach root cause analysis would be interesting. That's a really good one. I know people have to hop off now. I do know that our next structured collaborative, which will start in January, will be more focused on that collaborative approach. So we will take that specific recommendation right there for that group to make sure that we kind of expand on that a little bit. But as I mentioned, it'll be really beneficial to everyone if you guys are the ones presenting because you're physically doing the work right now. So thank you so much for joining us for our first ECHO with Superior Health. And we will see you all next week. Our topic is on choosing your team, committed staff, and teamwork. And that will be on December 8th, the same time. It's 10 Central, 11 Eastern. Thank you all for participating.
Thank you very much. Thank you all.